I want to say we are the practice plan of UW Health. We are the physicians. For those of you who think physicians cannot do this stuff, listen to what's following us. The clinicians, the physicians, the practice plan was the one who started this. Anyway, Michelle, it's all yours.
The way that we run our program, again, for our advanced practice providers, our clinical division administrators, department administrators, and some of the clinical managers, is application-based program. And the reason we do that, we really want people to be invested in the program and know that they're doing it because they want to, not because they were told they should. And so we do have an application-based program talking about their leadership philosophy. Why now? Why are they invested in the program? What do they hope to gain from it? And how will they apply that learning going forward? We also learned that because this is an 18-month commitment, it's important to have sign-off from their leaders, and so we do have a portion of the application where the leader does sponsor the individual because they will be gone from clinic, from the department, throughout that year-and-a-half process. Once we review the applications, we try to select the most diverse learning group that we can, and Rhonda can speak to this in a moment. We try to match the clinical expertise with the admin folks that we have. So you'll see advanced practice providers, we'll have folks from IS, we'll have folks from quality, folks from finance involved in the same cohort. And again, we're trying to make that cohort as diverse as possible to get people outside of their comfort zones. So we get together on a briefing day, and that really kicks off the program. It's a 4-hour session where we come together, give assignments, lay out expectations, get to know each other, and set the stage for probably one of the capstone pieces of the program, the Simulation Center. We run a 3-day assessment center where participants go through a number of group activities, individual activities, and they are observed and assessed by a group of their peers. Once we got the program going, we now have the assessor group that comes back are actually graduates of the program, so they've been sitting in the chairs of folks who are going through, and it's their way of giving back. So again, we run the 3 days. There are individual activities, group activities, and one, again, a highlight that we put into every program. We talk with senior leadership about a current situation or initiative that the organization is facing. Someone mentioned before restructuring, transition, the I word, integration, is one that many of us are grappling with. And so this year's case study, half the group was assigned a position that we should move forward toward internal integration and why. The other half of the group was told to take the position we should not integrate and why. So again, we have real-life application for things that the system is going through, and then they actually present their cases, debate their cases, and we share that feedback with senior leadership afterward. After the 3-day simulation center, the feedback is given to participants along with a report, a 360 report. We partner with Center for Creative Leadership, and we've designed a customized 360 tool, and so that 360 tool, in addition to the feedback from the 3 days, gives folks the impetus to start their personal development planning. From there, the debrief session, we get together to talk about what went well, what have they gained from it, and really set the stage for their year-and-a-half of learning, and that is cohort-based. We've tried it a couple of different ways. The approach we're taking going forward is meeting as a whole group of 12 every other month. Within that session, that full day, we talk about, again, case studies, readings. We have speakers come in from the organization, 1 to share their leadership story, and 2 to share organizational knowledge. So we do have some folks, for example, who are very strong clinically within their siloed function within the organization. They don't know about the organization outside of their specific area. So again, we're trying to create business acumen as well as their own personal professional development. And then, as mentioned previously, we also offer each individual the opportunity to participate in a capstone program, action learning that ties into things that are actually happening within the organization. Sometimes those happen individually. Sometimes we're able to divide those into teams and have the collective team approach a task together. The focus for the first 9 months of the program is their personal professional development. The second 9 months of the program focuses more on action learning and the capstone project that they're doing. So Rhonda is, again, a nurse practitioner, and she has been the director of our advanced practice for the past year, and she is a recent graduate of the Leadership Development Program. So I'm going to invite her to share her experience with you before we turn it over to Roger to talk about physician leadership development.
Thanks, Michelle, and I can't say enough how honored I am to be here, and really for UW Medical Foundation for really supporting this program. Just my own personal experience, when I joined the Leadership Development Program, I was a supervisor in our internal medicine practice, really growing our primary care models for NPs and PAs with physician collaboration on teams. And I would say nurse practitioners, and particularly PAs, have been really unrecognized potential for many leaders. They've been nurses, they've lived in various systems in our hospitals and clinics, and are really poised to take on leadership roles, many of them pursuing doctors of nursing practice and leadership roles in that academic setting. So one of the best parts of the program, I would say, was really that assessment piece and that simulation that Michelle talked about. I know when I came in personally, I had a lot of preconceived notions of how I thought I was maybe in a meeting. Maybe I was pushy, maybe I was too overconfident, so I better just back down and be quiet. When I went through the simulation center, I really got the feedback in real time and from assessors who didn't know me to share that feedback that really I stepped up in an appropriate way, that I knew when I should be quiet and let others participate. So that really, I think, set the forefront for me moving on and up now into my directorship role. The other part of the program I really appreciated was really that point we heard earlier today of leaders as teachers. We learned from our executive leaders about our organizational strategy, their vision, and change management. I think what I really appreciated was their own personal journey into leadership. I think many of us as young and developing, growing leaders think that there's some degree, there's some magic letters behind our name that will get us into certain areas of our system. And I found that many of our leaders had very unique journeys, and none of them were the same. So that was also very beneficial. And lastly, I think the other really valuable part was really the networking and the interprofessional networking that we had as a group. As Michelle said, we were clinicians, there was IT, there was finance. And we really grew together as professionals and helped problem solve around our own situations that we were having in our departments or clinical work areas, provide an area for discussion and really trust building. So I'm happy to answer questions afterwards, but that was really my personal journey in our leadership development program. Roger.
There was a little selling and support building we had to do. We got that done, and we moved on. I can tell you in the design and development of the program that one of the most important things was the schedule, was how we were going to deliver this. Were we going to do a week at a time, or were we going to do this, that, or the other thing? At the end of the day, our program is 2 years long, so you have to make a 2-year commitment. Basically, we meet once a month on Fridays. Sometimes it's Thursday and Friday, but rarely. We've really made a change to that. So people can block out their schedule. They're given the schedule when they apply so they know what it is. The application process is one where it's all self-application. Sometimes chairs or other leaders will encourage emerging physicians to apply to the PLDP. And I can tell you that since 2008, our first cohort, we targeted 20 physicians. We had 32 applications the first year, filled it with 20 physicians, and that was an interesting group because they saw this program for its content. I must tell you, over the course of time, because of some of the success we've had, some of the people who are applying now are seeing it as a way to get their ticket punched to be noticed by senior leadership. And that makes a difference in their learning enthusiasm sometimes. So we're on the lookout for that kind of situation. What I tell physicians is this program is to create revolutionaries within our organization. And we're looking for change agents. We're looking for people who know how to make change, what change makes sense, and all that. So our program is 2 years long, so it is not trivial by any means. All of the courses, I'll go through some of the content. We start with a 360 assessment. This does a number of things. Number one, we believe that leadership is largely determined by your self-evaluation, by understanding who you are and where you need to grow and where your strengths and weaknesses lie. So we start with that, and to some extent, this is a shock to the physician. The first day in class, we partner with Strategic Talent Solutions down here in Chicago. John Philbin comes up and debriefs them on their 360s, and it's a real, that's kind of a start of a little breakdown that goes on in terms of level setting the course about where their leadership journey is going to go, and it's very therapeutic. In my opinion. From there, we have 2 or 3 days where all we do is bring in leaders. The first set of leaders I bring in are non-healthcare leaders from the community, the CEO of American Family Insurance, or Barry Alvarez, our winning football coach and now athletic director, heads of corporations, and all I want them to do is talk about their leadership journey and what it takes, what they see in young people when they want to designate successors, et cetera. Then we go into content like negotiations, and you can see the list here. I'm running out of time, so I don't want to go there. But the point I want to make is every course there's an instructor where there's content. But over lunch, what we do is we bring in somebody from UW who's going to talk about how that interacts with UW Health. So for team building, we're fortunate enough that Mark Johnson from the 1980 Olympic team, who can talk better about, if you've seen the movie Miracle, Mark was in it, and he's also our women's hockey coach, and he's been a men's hockey coach. He's a terrific speaker. This is one of the riveting sessions we have. We also bring in, for getting savvy with the media, our PR and public relations and communications people to talk about bad stories, good stories, how we handled it, social media, all those things that leaders really have to understand. So you see our content. Some of it is experiential. Some of it is we read a few books. We really have to be careful about how much we load on the physicians because their time is valuable. I do want to say that the thing that makes this go, the thing that's most successful, if you asked a physician that's been through the program, and this year we had 65 applications for 20 spots. So I actually increased the program to 30. We've got nearly 100 after this cohort, physicians that have come out. Almost there's unanimity about the fact that it is the sitting together for 2 years with people they would have not met in the organization. We have 1,300 physicians. And it's that cross the room learning as well as the front to back learning that really cements this thing. We have lots of successes. A number of people have gone on for triple M's or MBAs. One chair came out. We did a recruiting for our chief medical ambulatory officer. There were 4 finalists. All 4 were PLDPers. So thank you for your time. It's a pleasure to be here. Thank you, Andy, for inviting us. We'll take some questions.